Hello and welcome to the online session. I am Dr. Raghavendra S. Hegde, working as a lecturer in Hanagal Shri Kumareshwar College of Pharmacy in the Department of Pharmacy Practice. Today, in this lecture session, we'll be trying to understand the syllabus for B.Pharmacy, 7th semester for the subject Pharmacy Practice. Okay, let us now understand the whole syllabus which is there for pharmacy practice. So the time allotted from the university through PCI, Pharmacy Council of India, has allotted 45 hours of the pharmacy practice programs for B.Pharm 7th semester. Now let us understand the scope of pharmacy practice. In the changing scenario of pharmacy practice in India, for successful practice of hospital pharmacy, the students are required to learn various skills which include drug distribution, drug information, and therapeutic drug monitoring for improved patient care. In community pharmacy, students will be learning various skills such as dispensing of drugs, responding to the symptoms of minor ailments by providing suitable safe medication advices to the patients, patient counseling for improved patient care in the community setup. And we can notice here the pharmacy practice is a wide branch which deals with many subjects. So many subjects come under the pharmacy practice area, whether it may be the hospital pharmacy or community pharmacy. Even some aspects of the clinical pharmacy, even the therapeutic drug monitoring is involved here for improving the patient care. The objectives of pharmacy practice for B.Pharma would be, upon completion of this course, the student shall be able to know various drug distribution methods in a hospital, how the drug distribution methods in a hospital takes place. Okay, to appreciate the pharmacy stores management and the control of inventory, to monitor drug therapy of patient through medication chart review and clinical review, to obtain medical history interview and counseling the patients, to identify DRPs, that is drug related problems, to detect and assess adverse drug reactions, to interpret selected laboratory results by monitoring parameters in therapeutics of specific disease states, to know pharmaceutical care services, to do patient counseling in community pharmacy, and lastly, to appreciate the concept of rational drug therapy. Now there are totally 5 units are there for B.Pharm pharmacy practice. The time allotted for unit 1 is 10 hours, and during this 10 hours period we'll be covering hospital and its organization, where we'll be seeing and trying to understand the definition, classification of hospital based on primary, secondary and tertiary care hospitals, classification based on clinical and non-clinical basis, later organization structure of a hospital and medical staffs which are involved in hospital and their functions. In unit 1 under B, here we'll be studying about hospital pharmacy and its organization, definition, functions of hospital pharmacy, organization, structure, location, layout and staff requirements, which are very important, responsibilities and the role and functions of hospital pharmacist. Again, under unit 1C, We will be studying adverse drug reactions, classifications of adverse drug reactions, and excessive pharmacological effects, secondary pharmacological effects, what is meant by idiosyncrasy, how do you define with examples allergic drug reactions, genetically determined toxicity, toxicity following sudden withdrawal of drugs, drug interaction, beneficial interactions, adverse interactions, and pharmacokinetic drug interactions. With examples, methods for detecting drug interactions, what is meant by spontaneous case reports and record linkage systems or record linkage studies, adverse drug reactions, how do you report it and how do you manage overall the adverse drug reactions. Again, in the same unit 1, under the heading D, we'll be learning community pharmacy principles, which includes organization and structure of retail and wholesale drugstore, types and design of community pharmacy, legal requirements for establishment and maintenance of a drugstore, dispensing of proprietary products, maintenance of records of retail and wholesale drugstore. That completes the unit 1. In the second unit, we'll be studying about drug distribution systems which takes place in a hospital, whether it includes dispensing of drugs to inpatients, types of drug distribution systems in the hospital, charging policy and labeling, dispensing of drugs to ambulatory patients, and dispensing of controlled drugs. Under Unit 2, under subheading Hospital Formulary, we'll be studying the definition, contents of hospital formulary, differentiation of hospital formulary and drug list, preparation and revision, and addition and deletion of drug from the hospital formulary, what are all the conditions, what is the criteria for addition and deletion. In the Unit 2, under sub C heading, we'll be studying about the TDM principles, that is therapeutic drug monitoring. What is TDM? Necessity for TDM, factors to be considered during therapeutic drug monitoring, and based on Indian scenario, what is the scenario for therapeutic drug monitoring in India? In the Unit 2, under subheading D, we'll be studying about medication adherence. Definition, causes of medication adherence as well as non-adherence, pharmacist role in medication adherence, monitoring of patient by implementation of certain strategies which checks about medication adherence. Unit 2, under subheading E and F, will be studying about patient medication history interview, how to take the history, medication history, need for patient medication history interview, how to collect the information, how to review the patient history profiles, medication interview forms. And in F, in the Unit 2, we'll be concentrating on community pharmacy management, which includes the financial aspect, materials, staff and infrastructure requirements for running community pharmacy. And Unit 3, the time allotted for Unit 3 is 10 hours. Here we'll be studying about the Pharmacy and Therapeutic Committee, which is P and TC, which includes the organization, the functions, policies of the Pharmacy and Therapeutic Committee in including drugs into formulary, which all the drugs has to be included in the formulary, what is the criteria for inclusion of drugs, inpatient and outpatient prescriptions, how it has to be managed, how to manage in case of automatic stop order and emergency drug list preparation. In the Unit 3, again in the subheading B, we'll be studying about drug information services, where we'll be studying drug and poison information center, their role, why there is necessary for drug information or poison information center in the hospital, the sources of drug information, computerized services, how it becomes helps to the community pharmacy or hospital pharmacist or clinical pharmacy by generating the computerized services, how we can maximum utilize the computer here, and the storage and retrieval of information. In the unit 3 again we'll be learning the patient counseling. What is patient counseling? How do you define the term? Steps involved in patient counseling and the special cases that require the pharmacist counseling. Okay. And in the unit 3, under the subheading D, we'll be learning about education and training program in the hospital. There, we'll be trying to understand the role of pharmacist in the education and training program, internal and external training program, services to the nursing homes or clinics, code of ethics for community pharmacy, what it is, how the code of ethics plays a great role, and the role of pharmacist in the interdepartmental communication and the community health education. Lastly, under the unit 3, we'll be learning prescribed medication order and the communication skills, prescribed medication order interpretation and the legal requirements, and communication skills, which is a major thing which is required for each and every drug therapy monitoring, how the communication process has to be carried out, whether with prescribers and the patients. That completes the unit 3. In the unit 4, we'll be trying to understand the budget, how to prepare it and implementation of budget. In the unit 4, under the subheading clinical pharmacy activities, the core principles of clinical pharmacy, we'll be learning here about introduction to the clinical pharmacy, the concept of clinical pharmacy, function of clinical pharmacy, the role and responsibilities of clinical pharmacist, by whether it may be the drug therapy monitoring, medication chart review, clinical review, how the pharmacist intervenes the patient, that is called as pharmacist intervention. What is the role of pharmacist during ward round participation, medication history and providing pharmaceutical care, the dosing pattern and drug therapy based on pharmacokinetic principles and disease pattern. In the unit 4, we'll be covering over-the-counter drugs, what it is, and sale of over-the-counter, which section the over-the-counter medications comes, and we'll be studying about the rational use of common over-the-counter medications. Last unit, the time allotted is 7 hours. Here we will be studying about the management and inventory control, drugstore management and inventory control, that is, which includes organization of drugstore, the type of materials stocked and storage conditions, purchase and inventory control, principles, purchase procedure, what is the procedure to purchase the drugs, how to generate the orders, purchase order, procurement and stocking, what is economic order quantity, what is reorder quantity level, and what are the methods used for analysis of drug expenditure. We'll be covering all these things in drugstore management and inventory control. And lastly, 2 headings, that is investigational use of drugs and the interpretation of clinical laboratory test. In investigational use of drugs, we'll be studying about description, the principles involved, classification, control and identification, and the role of hospital pharmacist in investigational use of drugs. What is advisory committee and what is their role? Lastly, we'll be studying about the interpretation of clinical laboratory tests, which include blood chemistries, hematology, and urine analysis. So the proper interpretation of all the laboratory results, how you interpret it, and with your understanding, whether it may be the hematology, the chemistry, blood chemistry, and urine analysis, how you come out with conclusion, okay, for the patient care. That completes all the 5 units here. The time allotted for all the 5 units is 45 hours from the Pharmacy Council of India. So we'll be covering all these things in this session one by one. And the recommended test books, you can purchase it, or you can take the help of library for retrieval of information, which may be the Merchant SH and Dr. J.S. Kadri, which is a test book of hospital pharmacy, the 4th edition, which is from B.S. Shah Prakashan. And one of the most popular test book is the test book which is used by clinical pharmacy practice students is the Parthasarathy. Okay, clinical pharmacy practice by Parthasarathy. And William E. Hassan for hospital pharmacy, Tipnis Bajaj for hospital pharmacy, which is from the Career Publications, and Basic Skills in Interpreting Laboratory Data, which is from American Society of Health System Pharmacists. And lastly, N.S. Parmer have written Health Education and Community Pharmacy, which is from CBS Publishers and Distributors. These are all some of the recommended test books for reading and understanding the subject of pharmacy practice. Now with this, I want to end my session. So all the best, and keep always learning, because learning is continuous and never-ending process. Thank you.